Okay, welcome back. Sunrise continues, and we're looking at value for human lives. There's a quote I have here. It says, "Life has no meaning beyond that which you give to it." So if you do not give value to life, it has no meaning. You're just living and you're moving on. Now, putting a price on human life may seem callous, but for safety analysis, it's simply necessary. I mean, life is priceless, but yet you have to price it just so that you can be able to analyze it. Because if you say it has no price, then how do you value it? They judge whether a certain safety regulation will be cost effective by comparing how much it will cost to implement it with how many dollars worth of human lives it's likely to save. These are all ways to analyze how much value is placed on human lives. They also judge the value on human lives on how much of infrastructure is provided to make life a little bit more comfortable for those living around, especially in Nigeria and around the world. Well, we have a doctor who is part of the Flying Doctors Nigeria, Dr. Ola Orekunrin, here at Speaker. Thank you for coming on.
Thank you.
So how much value do you have on life?
I think it's interesting. I was watching your last discussions about the Chibok girls, and I've been also paying a lot of attention to the news, and I've been seeing, the type of drones that they've been bringing from America. The one of them that they call the Hawk, it looks almost like a spaceship. And this is what they've been bringing all the way from America here to look for 200 girls. And, it's fascinating, I think, the difference that we place on human lives. I mean, the kind of infrastructure, the kind of equipment, the kind of attention that is paid to a single human life in the West, I think is very different from what we do here. And it's not a government issue. I was speaking upstairs because I grew up in England about the hundreds of charities that ordinary citizens have set up to help soldiers when they come back from war. So
set up by ordinary citizens.
Set up by Help for Heroes. There's hundreds. There's even a day where a certain NGO has a poppy. This is nothing to do with the government. You pay for that paper and you wear it on your chest for up to a week to remember soldiers that have died. And if a soldier from your area has died, then everybody, that whole area of England is very sad. We all know the person's name and we all used to remember that person. Whereas coming here, there is, I think, a huge difference in terms of what we value a human life to be, or the value that we place on a human life. And I think that we're very, very quick to point the finger at government, but I had a quick look on Google. We don't have a single charity set up for our soldiers. We don't have any. I mean, in England and America, there's huge concerts where all the performers will perform for free to raise money to support the military. We don't have that here. So I think that there's a huge difference between attitudes that not just the government, but maybe we ourselves need to be a bit more introspective and think, what could we be doing? The medical, a lot of the medical fees, for example, the post-traumatic care are run by charities. A lot of them in Europe, and we've never thought about setting up these things. We think everything should be taken care of by government. And when I was coming into Nigeria, I set up a few years ago, about 4 to 5 years ago now, I set up the first air ambulance service in Nigeria. So the purpose of an air ambulance service and what we've been doing for the past few years is conveying people by helicopter or by fixed wing jet from areas, rural areas, sometimes remote areas, offshore areas, into areas where there's a more suitable level of care. Usually about 60% of that time it's somewhere else within Nigeria, or sometimes it's even somewhere in West Africa, for instance, into Nigeria. And sometimes that's from Nigeria abroad, depending on the kind of injury that is sustained. But this Wednesday we're going to be doing something very special. We're going to, in conjunction with the FRSC and our aviation partner OAS Helicopters, we're going to be doing probably one of the first ever road accident rescues. So we're actually going to land in the middle of the road and pick obviously a fake casualty and take them to hospital by air. And that's going to be one of the first times that this has been done.
Okay. It's obvious that like saving a human life is worth quite a lot to the society.
It really is. And especially in the area of road traffic accidents, I think that these sort of incidents, these sort of accidents don't really, they're not really governed by age, by socioeconomic status. I mean, if you've been following the news, you'll see that our vice president, I think it was his brother, had a road traffic accident. The First Lady's, I think it was mother, had a road traffic accident, as well as thousands of people across the continent. In fact, the WHO estimates that the third highest cause of death in young people is road traffic accidents, ahead of TB, ahead of malaria, ahead of tuberculosis. And that's why, along with the FRSC and OAS helicopters, obviously, we're trying to focus down on this problem and sort of change the perception of the value of a human life.
I was going to ask you this. In the midst of all of this, as a medical doctor, with all that you've been doing, and we talked about the Chibok girls and what
Absolutely.
the soldiers are doing and how much they're not being really supported in terms of the citizenry. What value would you place on a human life if you were asked to quantify it?
That's a really difficult
or how do
question.
Yeah, let's.
That's a really difficult question, and I think that even the most civilized societies, I think, do kind of place different priorities on different human lives. So the president has a lot of security, whereas the ordinary citizen does not, and that's not how it's supposed to be, actually. But I wouldn't place a dollar value or a naira value on a human life. But my point is that I think that we as a people, not isolating the government, not isolating the military, not isolating anybody, not pointing any fingers, but we as a culture, as a people, need to raise the value that we place on human lives, I think.
You must have done a bit of research before you put together the Flying Doctors.
Yes.
And one of it might just be the response time.
Mm-hmm. Absolutely.
You know, the safety. People also dying on their way to the hospital.
Absolutely. Absolutely.
Moving forward, what are you how do you intend to bridge the gap, I mean, practically?
Absolutely, that's a really good question. There's a concept in trauma medicine called the golden hour, and there has been research all over the world that suggests that if a person reaches the right hospital, and I emphasize on right, and the reason why I'll come back to why I'm emphasizing on right, if the person reaches the right hospital facility within a single hour, then the person has about 80% chance more of surviving that injury. Now, Nigeria is a very vast country with a huge road network, and sometimes finding, for instance, a road traffic accident with a head injury where somebody needs a neurosurgical intervention, because obviously it's not every surgeon that can be confident enough to do brain surgery. This is a specialist area. Sometimes it can take 8 hours, 9 hours by road to reach that sort of specialist. And that person will die not because there was not the person available, but because the transport time between where the person had that accident and where they could be treated was huge. So what we're trying to do with the air ambulance is cut that time significantly. So those kind of journeys can be made in an hour and a half, and get the right patient to the right medical facility to see the right kind of specialist within the correct time frame.
Also, you've spoken about breaking down the time,
Absolutely.
How about, do you have facilities in place to determine what doctor the person might need? For example, when you pick up the patient into your air ambulance, the helicopter, do you start to do diagnosis right there? Do you have facilities on board?
Absolutely.
So it's like a mini hospital till you get to the real hospital.
Yeah.
Is that what you're saying?
Yeah. So that's another really important point that you've just raised. It's only when you get to the scene that you'll know what kind of injury you're dealing with, and immediately the phone calls have to go out and say, the FRSC are also very well trained. They have paramedics, so they will probably know that, okay, this person needs to see a neurosurgeon, this is a cardiothoracic injury, this is an orthopedic injury, this is somebody that needs to see, this is somebody that needs to be operated on by a colorectal surgeon or a pelvic surgeon. And these people are, scattered around the country. These specialities are scattered around the country. So we would have had an idea, even before we launched the helicopter, of what hospital this needs to go to. But on assessment by a doctor, that will confirm the diagnosis and say, okay, this person definitely needs to see this pelvic surgeon that can do this operation and transfer the...
Sorry, one last question from me. You probably work with a team of doctors. Tell us more about your team.
Our team consists primarily of anaesthetists, so they're critical care specialists. As you can imagine, an air ambulance is not for every patient. It's for very, very sick patients. So critical care specialists are doctors. We have about 50 across the country in Lagos, Abuja and Port Harcourt, which are the airport hubs that we operate out of, who are very used to dealing with people that, to be honest, are half dead. Usually they're not breathing, so sometimes they'll need a machine to assist them with the breathing. A lot of the times they have one or two organs failing, so obviously they need certain drugs which have to be titrated very, very specially to keep the blood pressure flowing, to keep the blood pressure up. And it's a very specialist area that not many doctors know about. When we talk about inotropic drugs, for instance, these are the ones that keep the heart beating, using a mechanical ventilator, I spoke about that before, making sure, deciding how much the person is going to breathe and how fast the person is going to breathe because they're not breathing on their own. So we specially look for these kind of doctors that really can make the difference when we're talking about the kind of category of patients that we're talking about. Young kids who deteriorate very, very quickly, very severe injuries, making sure that they get to the right facilities on time.
Okay. In doing all of this, with all the equipment you have, with the professionals that you have, if the individual professional does not value life, how would it work?
If the doctor doesn't value life,
it's possible.
It's
does not place that amount of value you place